Hello and very good evening to all those who have tuned in today. I'll be taking the class on dental auxiliaries for the NEET preparation. So before we go delve deeper into dental auxiliaries, the term auxiliary, plain English, refers to an addition or some sort of an adjunct. So when we refer to the term auxiliary in healthcare, you're basically referring to any technical worker. It doesn't depend on the field they're working in, but it's any they have to be a technical worker and they have less than full professional training. So that is auxiliary. So the same thing when we apply to dentistry or the dental auxiliary, it's basically a generic term. It's for all those people who assist the dentist in treating patients. But the key is here, they are not fully, they do not have a full the professional training. They're also called dental ancillaries in the UK. So whenever you see any term that says dental auxiliary or dental ancillary, they're referring to the same thing. So the definition is that it's any person who is given responsibility by a dentist. Why? So that they can help the dentist render care, but who is himself or herself not qualified with a dental degree. So this was the definition given by Slack in 1960. You could remember the year. But before we move into auxiliaries, we need to know what three terms mean. The first one is licensure. So licensure is basically the process by which any agency, it's usually government or sometimes government-funded agencies, they grant permission to people. So they don't do it to everybody. In order to be able to get that permission, you have to meet certain predetermined qualifications or engage in an occupation or use a particular title. Now, for example, anybody and everybody cannot drive a vehicle. You have to give your licensing exam and then you are given a driver's license. So that's basically the permission from the government side. And what are the predetermined qualifications? You have given the test or you are qualified or you have been assessed to be capable to go ahead and drive. Similarly, even if you were to practice any professional occupation in any other country, for example, a law or even dentistry for that matter, if you were to move to other countries or if people were to move to India to practice medical dentistry, law, you'll have to give a licensing exam. So once that is done, you're given the license. The second term is registration. Now, registration is basically you have an official roster or a register where there's a list of qualified individuals. This is either maintained by the government or a non-government agency, depending on who is running that association or rather who is maintaining that roster. So we fill in these, and once you fill in the details required by the agency you're registering in, you are officially a member of that agency. Now, for example, we are all members of the Dental Council of India through your state dental councils, or your IDA members, or you may have a local club or a local agency like Lions or Rotary. So you have a membership form. You fill it, and your name automatically gets added into the official roster of that particular agency. Third thing is certification. Now, certification is a process by which any authority, any body of authority, it could be a government agency or a non-government agency, it's basically granting you recognition and say and that recognition basically means that you have met whatever predetermined qualifications or specifications they have. For example, if you have taken part in a program, you have sat through the program, listened to the program, actively participated. So once that is done, they give you a certification, which is usually in the name of the agency giving, saying you have met all these criteria, you've been a part of this, or you've participated or you have volunteered or contributed to the success of this program. So these are three terms that we need to remember. So coming back to dental auxiliaries. So dental auxiliaries, like we discussed earlier, are basically people who are appointed by the dentist to help the dentist, but they themselves are not qualified to offer care. So why do we need auxiliaries? Or how would employing people would actually make a difference to dental care that is being given? What happens is when you have auxiliaries, you're increasing the manpower. So basically, you're able to provide more and better health services to the community. Thereby, when you look at the large picture, more people are able to get good oral health services and thereby maintain their oral health. You can also provide a better coverage for various preventive services. It could either be to an individual or to a group. The stress is taken off the dentist. Plus, you have more sections of society, different strata of population who are being served because you're having more people coming in to work with you. It's as simple as that. You have better job satisfaction for the dentists and other dental personnel. So overall, you are leading a better quality of life. Basically, there's sharing of the workload. There's less time consumption for various procedures that's being done. Thereby, the dentist does not feel as fatigued and is able to provide better quality and standard of work. So there was a program in 1961, which is called the Dental Auxiliary Utilization Program in the US. And once they did that, they were able to observe that addition of one assistant to dental practice could actually lead to a 33% increase in number of patients that is treated. So basically, you're increasing the productivity. So the 33% of patients that you're treating is not being done by the dentist alone, because that would then cause the dentist, maybe the quality would be compromised, maybe the dentist would not be able to deliver care. But the thing is, because you're adding another dental surgery assistant, you're doing that while maintaining a healthy environment. Coming to the classification, the initial classification basically divided your auxiliaries into non-operating, that is, people who do not operate on the patients. They can either be your clinical auxiliaries or your lab auxiliaries, and operating auxiliaries. Those are people who operate. But the revised classification, it has the same two categories, but then there are various types of auxiliaries included in both. So the ones in which you have specific names, that's your revised classification. Where you just have clinical and laboratory under non-operating, that's the earlier classification. So when we look at the revised classification under non-operating auxiliaries, you have your dental surgery assistant. Remember, the assistant only assists. The assistant does not have anything to do with the patient's oral cavity. The assistant does not treat. Then you have the dental secretary or the receptionist. Similarly, the receptionist sits at the reception. They also have nothing to do with the patient's oral cavity. So these are ways in which you can remember that they are non-operating auxiliaries. Then you have the laboratory technician. I'm sure everybody in your colleges in prosto or in ortho, you will always have a lab technician. No, you don't see the lab technician going and inserting the denture, right? So the lab technician again is a non-operating auxiliary. And you have your dental health educator. That is people who provide dental health education. So they are just giving education, like they are telling, brush twice daily, or modify, eat healthy, reduce your sugar intake. So they have nothing to do with the oral cavity. They are providing education to everybody. So they are your non-operating auxiliaries. When you talk about operating auxiliaries, you have your school dental nurse. So remember, a nurse always also provides various intra oral, no, not intra oral exactly. See, they provide your IV lines and things like that. So so when you're thinking along the same lines, you can think of school dental nurse as being an operating auxiliary, a dental therapist who's providing restorative or any other care, a hygienist, many of you may have noticed in your periodontics department, and your expanded function auxiliaries. So, like I said before, a clinical non-operating auxiliary is who performs clinical work. They assist the dentist, but they don't carry any independent procedures in the oral cavity. And a laboratory non-operating auxiliary is one who, again, assists the dentist by carrying out lab work. And operating is they carry out procedures in the oral cavity, but are always under the direction and supervision of the dentist. So that's in the definition of auxiliary itself. And that is understood. No auxiliary usually provides any sort of care without the supervision of a dentist. Again, moving ahead with our different types of auxiliaries. When you see dental assistant, chairside dental assistant, dental surgery assistant, they all mean the same thing. So what do? They basically assist with clinical work, but they don't independently carry out any procedures in the mouth. So what do? They are involved in receiving the patient, preparation of the patient for any treatment that they require. They sterilize your instruments, keep the instruments ready. They also help in mixing materials. It could either be your restorative cements or your impression material. They load it onto the tray and give it to you. They help to prepare the operatory for the next position. Like remove all the disposables, clean up the chair, keep fresh instruments, tumbler, keep the drape ready, and things like that. They also help in giving the dentist patient's documents, allowing them to fill it up and then filing it. They help in taking radiographs. They instruct the patient with proper healthcare maintenance and hygiene, and are basically involved in caring for the patient up till the treatment ends or until they leave, especially if they are under general anesthesia or whatever. Now, when we speak about dental assistants, the next thing that comes to mind, or rather should come to mind, is your four handed dentistry. So, this is basically an art of seating both the dentist and the dental assistant in such a way that both have easy access to the patient's mouth when the patient is in supine position. Okay, so why do we need this? This is basically to minimize stress and fatigue. I'll tell you how. And it helps to maintain and increase productivity without reducing the quality of care. So what should the assistant do? Now the dentist is the one who's providing care, right? What should the assistant do? The whole idea is they need to anticipate what instrument the dentist is going to use next, or what the dentist is going to be doing next, and hand it over to the dentist as and when required. So the dentist would not have to keep moving to pick up the instrument. They can also do other functions like retraction, aspiration. Basically, it's basically complementing the dentist and, like, managing the whole place so that the dentist can work efficiently. So there are four principles basically of your four-handed dentistry. First one is the position. Basically, the dentist or the hygienist and the assistant need to be, and the patient have to be seated in position properly. If you can see in the image on the right side, you have your static zone, assistant zone, transfer zone, and your operator zone. So operator zone is basically the amount of area where within which the operator is free to move without any hindrance. Static zone basically is the area where as such there is no movement or nothing that is happening, so you can keep your instruments there. The assistant zone, which is in blue, is the amount of area that the assistant can use to move, and the transfer zone is the area where the assistant is going to be handing over the instruments to the dentist who's working, or going to be receiving the instruments. So first is your position, then is the utilization of your assistant. So basically, you have to use the assistant to their full competence, either in receiving instruments and handing over instruments. You can probably tell them what is the procedure that is going to be done, what instrument would you be using, what do they have to give you after which, when do they have to retract, when do they have to use the suction tip to aspirate, and so on. The third thing is your treatment organization. Basically, the whole idea of this is to ensure that the patient's treatment is organized. And what happens then? Your repetitive tasks become simpler. So basically, you're using your chairside time, you're using it in a much more efficient way. You're not wasting time unnecessarily. And the fourth thing is your equipment management. So whatever equipment that is being used has to be selected carefully, properly positioned. So the assistant will give it to you as and when you require, and not have it all messed up and then have them searching, saying what instrument to give and which. So what happens is your work is simplified when you know what comes after what, and when it's arranged neatly, you know what to pick up and give, and you know what to put it back and things like that. The second non-operating auxiliary is your secretary or your receptionist. As the name indicates, they basically assist the dentist with secretarial work. And as such, they don't require any formal training. It's usually on the job. So while they join, they probably take a month or two to learn how it works, and then they start. The third one is your dental lab technician. They're also called dental mechanics. So, the dental mechanic is a non operating auxiliary whose primary work area is the laboratory. So, what do? They work to construct dental appliances according to what has been prescribed by the dentist. Now, they do not have the autonomy to prescribe whatever they want and give. So, the prescription needs to be given by a dentist. Saying, okay, require a complete denture or a removable partial denture, say, with these many teeth or these specific teeth or a crown for this tooth. So depending on the prescription that is given by the dentist, these people, these auxiliaries fabricate your appliances. So they're individuals who have the skill and the knowledge in fabrication of dental appliances, prostheses, and devices in accordance with the dentist's laboratory work or authorization. So they're basically trained for 2 years. Initially, earlier they used to learn this art through apprenticeship, but now they are trained. It's a 2 year program, either at a dental school or a technical college. Now, this is a this dental auxiliary. They are allowed to practice in India. We have lab technicians and hygienists. It's a 2 years course after your 10th or 12th standard. So what do they do basically? According to the written instructions of the dentist, they receive the patient's impressions as taken by the dentist, and based on whatever is required, they fabricate. It could either be your complete dentures, your partial dentures, crowns, veneers, and even orthodontic appliances and splints. So when you speak about a dental technician, there's another auxiliary who's similar but not the same. So that is your denturist. Now you need to remember the difference between a dental technician and a denturist. Now a denturist is a dental technician who is permitted in some places to fabricate dentures directly without the dentist prescription. So they on their own fabricate dentures. So they are allowed to practice in a few states in Canada, in the USA, and in Denmark, not in India. So the main difference is a dental technique. Both of them fabricate prostheses for the patient, but the dental technician does it following whatever is being prescribed or required by the dentist, while the denturist does it without the dentist's prescription. So more or less the duties are the same. They are allowed, but denturists are allowed to make impressions, whereas dental technicians receive the impressions that have been made by the dentist. So then they construct their dentures or whatever other work is required. They are also allowed to fit and modify new dentures, to repair, realign, rebase dentures, and to fabricate various other processes. The last non-operating dental auxiliary is your dental health educator. They are basically those auxiliaries who instruct in the prevention of dental disease. So what do they do basically? They impart important information regarding oral diseases. They help to educate the community on how to maintain good oral health, how to prevent oral diseases. When you see what signs are you required to go to a dentist, how often should you visit a dentist, what are those deleterious practices that you are not to do, which will negatively impact your dental health and your general well-being. And in some places, they may also be permitted to apply preventive agents intraorally. So these were with the non-operating dental auxiliaries. They were your dental surgery assistant, your dental technician, then you have your dental receptionist or your dental secretary, and your dental health educator. So now when we come to the operating dental auxiliaries, they are basically people who carry out certain procedures in the oral cavity under supervision, of course. So the first one is your school dental nurse. So who are school dental nurses? They're basically those auxiliaries who are permitted to diagnose dental disease and plan and carry out specific preventive and treatment measures to treat dental diseases in school children. So basically, the target is for school children, and they are permitted not only to provide treatment but also to diagnose, to plan, and to carry out the specific preventive and treatment measures. So usually they're expected to provide care for children at nearly 6 months interval. So every 6 months they're supposed to take a look at and provide care. So this scheme was first established in Wellington in New Zealand in 1921 by T.A. Hunter. They set up this Dominion training school for nurses then, which was the establishment from where dental school nurse curriculum or scheme actually began. This is again another question that you have to remember. So usually when you see school dental nurse, sometimes in brackets you see New Zealand type. So that's because this was initially started there in 1921 by T.A. Hunter. So the background for this is that there's usually the presence of extensive dental disease in children, and that is actually the best age to interrupt and to not only reverse all the reversible conditions or to provide care, but it's also a very good age to provide and impart proper oral health education so that in the long run they develop good behavior. The treatment of children was also difficult because there's insufficient dentists, and there was a large distance between communities way back then. And the whole idea of the school dental nurse is that they would provide the bulk of treatment in school dental service. So, with these ideas in mind, in 1921, they actually began the school dental nurse scheme. These dental nurses are trained for 2 years. They undergo training for 2 years, and post that, through the government, they are assigned to schools. Now, there's one dental nurse assigned to a school of 400 children in areas where there is no fluoridation or low fluoridated areas, and to schools containing up to 750 to 1000 children in areas where there is where there are other methods of fluoridation available. It could either be your topical fluoride systems like your fluoridated toothpaste and mouthwashes, or your systemic fluoridation methods. So basically, the target age for school dental nurses are 2.5 years, that is your preschool children, up to 13 years of age. So their work is evaluated by your school, by your dental nurse inspector, and by your principal dental officer. So what functions do these school dental nurses have? They are allowed to do an oral examination to diagnose and to give a treatment plan. They're allowed to provide oral prophylaxis, your topical fluoride application, give people advice on their dietary supplements, fluoride supplements, administer local anesthetics, prepare cavity and fill it with amalgam, pulp capping, extractions, provision of instructions on toothbrushing and oral hygiene to everybody. They also play a role in your dental health education at the school level, in the classroom and during parent teacher meetings and things like that. And they refer these patients to a private practitioner if any serious or complex services are required. Basically, all your auxiliaries are involved in provision of dental health education. Amongst all of them, if you are asked to pick, it's your dental health educator. But otherwise, all of these are involved in imparting dental health education. The second operating dental auxiliary is your dental therapist. So they are permitted to carry out procedures as per the prescription of a supervising dentist. What procedures do they carry out? Different preventive and treatment measures, including preparation of cavity and restoration of teeth. So this began in the United Kingdom in 1962. So you can see that dental therapists are also called New Cross auxiliaries because the training occurred in the New Cross area in United Kingdom. So basically, they are allowed to work based on the plans written by the supervising dentist. But there is a big difference between your dental therapist and your school dental nurse. While most of their duties are more or less the same, the main difference is that dental therapists do not, or rather, are not allowed to diagnose and plan dental care. Whereas your school dental nurses have that authority. They are allowed to diagnose and to plan and to provide certain treatment, of course, not everything. But your dental therapist can only provide care, whatever care is required as per the supervising dentist. They are not allowed to diagnose and plan dental care. They are also trained for a period of 2 years. So what do they do? Once your caries diagnosis is done, depending on that, they go ahead with cavity preparation in deciduous and permanent teeth. They help in material handling and they have restorative skills. So you can use services of a dental therapist in case wherever restorations are required. They are allowed to perform vital pulpotomies under rubber dam in deciduous teeth. All of this under the supervision of the dentist. They're also allowed to extract deciduous teeth under local anesthesia. The next operating dental auxiliary is your dental hygienist. So these are those auxiliaries who have completed an accredited dental hygiene education program. That's the first thing. They have completed a program and they have been licensed by the State Board of Dental Examiners to provide preventive care services under supervision of a dentist. So there are two things here. They are licensed, they have completed a course and are licensed to provide preventive care services under the supervision of a dentist. So Dr. Alfred Fones is considered to be the father of dental hygiene. So what he did was he noticed way back in 1905, 1906 that a lot of women were basically pretty hesitant, to go ahead and take dental care. And he trained his cousin, that's Mrs. Irene Newman, in these procedures of dental hygiene. She was the first dental hygienist. This program was established in Bridgeport in the US in 1913. So, dental hygienists also are trained for 1 to 2 years and they provide various services. So, dental hygienists, according to the Indian Dentists Act, they are allowed to be trained and allowed to practice in India. What are their duties? They basically provide oral prophylaxis. They also provide topical application of fluoride sealants and other prophylactic solutions. They are involved in screening or preliminary examination of patients in specific groups, like your children or your industrial employees, whenever you go out on screening camps. And then they can be referred to dentists for treatment, and they provide instructions in oral hygiene. They also are a huge source of work in dental field, especially with regard to whatever was mentioned earlier. They are allowed to take and develop dental radiographs, make impressions, apply and remove periodontal packs, and teach patients appropriate oral hygiene strategies. So in Denmark and Netherlands, they are also allowed to make a preliminary examination and charting of teeth. Otherwise, the only auxiliary who's allowed to diagnose and write down a or plan a treatment is your school dental nurse, except in Denmark and Netherlands, where dental hygienists are also allowed to um, go ahead with the preliminary examination of your patients. Okay, so the last operating auxiliary are your expanded function dental auxiliaries. So these are basically your dental assistants or dental hygienists who have received further training in duties that are related to direct treatment of patients. But all of this is still under the direct supervision of a dentist. So they do not diagnose or plan or prescribe drugs, but they are allowed to perform reversible procedures. So when you use the term reversible procedures here, it means all those procedures which could be repeated by the dentist without causing any harm to the patient in case the auxiliary does not perform it correctly or up to the mark that is required. Okay, so what do they do? Placing of rubber dams, restoration of teeth, radiographs, taking radiographs, making impressions, application of topical application of fluoride, so on, like making your impression trays, study models, removing and placing matrix bands, sutures, and so on. So there is a term called technotherapists that have to be remembered here. They are basically the first large-scale service application of your expanded duty function dental auxiliaries. They were this term was came into existence in Philadelphia in 1973. Technotherapists. Okay, so we finished discussing the non-operating dental auxiliaries and the operating dental auxiliaries. So now we are moving towards the other type of dental auxiliaries, which as such do not fit into that classification, but which are still widely prevalent in different parts of the world. There are another group of auxiliaries called frontier auxiliaries. So the whole idea of these frontier auxiliaries is that, especially in developed countries, dentists tend to concentrate in the urban center, and these are pretty far from various the communities or your rural areas for them to actually come till the urban center to receive care. So and these for these inhabitants to actually receive regular comprehensive care or emergency pain relief is actually pretty large and difficult. So the whole idea of these frontier auxiliaries is that you can train them to provide valuable service with minimum training in these areas. Basically they serve as that bridge between dentists and the population. So they can be trained to perform simple prophylaxis, to provide basic dental health education, to provide dental first aid in case of any pain or in any other conditions, and you can they can be used to refer them to the closest dentist. They can also organize, your fluoride rinse programs in schools or in small communities, and so on. The newer auxiliary types are your dental licentiate and your dental aid. These were given by the expert committee on auxiliary dental personnel, who is a dental licentiate. He's a semi-independent operator, usually trained for 2 years. So what does a dental licentiate actually do, or what is he allowed to do? Perform dental prophylaxis, cavity preparation along with filling of primary and permanent teeth, drainage of dental abscess, treatment of various prevalent diseases of supporting tissues of teeth, and early recognition of serious conditions. Okay, so who's a dental aid? So a dental aid is that auxiliary who performs various other duties that include first aid procedures for pain relief, control of hemorrhage, and recognition of dental diseases enough to justify transportation of the patient from to a center where proper dental care is available. Dental aid's formal training period extends from 4 to 6 months. Okay, so uh, the newer dental assistants that have been given by the Californian Dental Association in 2006 include your registered orthodontic assistant. It's basically your dental assistant who is trained to assist in various orthodontic procedures. Your dental surgery assistant and your registered restorative assistant, respectively. Okay, for these. Now, this much was with regard to the auxiliaries. Next, we're going to be moving to another important concept, which is your levels of supervision. Now, there were 4 levels of supervision given by the ADA in 1998. First is your personal supervision, then you have direct supervision, indirect supervision, and general supervision. Now, any and every procedure that is performed by an auxiliary is almost at all times supervised by the dentist who is present. Unless, of course, there are various procedures like how we said, your school dental nurse or a denturist sometimes. Apart from that, it is understood and is an integral part of any service that is offered by an auxiliary. That is, it always needs to be done under the supervision of a dentist. So when we speak about supervision, we're going to go into detail with regard to each of this, what these are. So the personal supervision is when your dentist is personally operating on a patient and he is authorizing the auxiliary to help in treatment by concurrently performing supportive procedures. Now, for example, if you were to look at this image, you can see that the dentist is go ahead and probably preparing a cavity. You have the dental assistant who's not only holding the suction, not only aspirating, but also helping to isolate and maintain that area clean. So the auxiliary is only aiding in treatment by uh, performing supportive procedures simultaneously. This is your personal supervision. Direct supervision is when the dentist is actually in the dental office. The dentist has diagnosed the condition that has to be treated. The dentist has given an authorized saying this procedure needs to be performed, and is remaining in the dental office while the procedure is being performed by the auxiliary. So once that is done, the dentist is going to come back, take a look at it, and evaluate the performance of the auxiliary before sending the patient. Now, for example, if the patient has gingivitis and requires prophylaxis, so the dentist is going to come, diagnose the condition, is going to take a look at the oral cavity, is going to go ahead and say, okay, this patient has gingivitis and there's a whole lot of calculus and plaque, and decides and goes ahead saying, okay, this patient requires oral prophylaxis. The dentist authorizes the procedure, tells the auxiliary or the hygienist to go ahead with the procedure, and remains in the dental office while the hygienist is doing the procedure. And once that is done, once the hygienist is done, the dentist comes back, takes a look at it, evaluates the procedure that's been performed, and once the dentist feels it's okay, you can go ahead and dismiss the patient. Then the patient is sent. Now, this is your direct supervision. Indirect supervision, however, is slightly different. The dentist here is still in the office. The dentist has only diagnosed the condition, the dentist has only authorized the procedure, and is remaining in the dental office while the procedure is being performed by the auxiliary. So the difference here is that once the procedure is done, the auxiliary can go ahead and dismiss the patient without waiting for the dentist to come back and evaluate the work that is being done. So that is the difference between your direct and indirect supervision. Then you have your general supervision. So basically, the dentist has authorized whatever procedure has to be done, and the dentist is told this is the diagnosis, this is the treatment plan, this is what has to be done, go ahead and do it. But the dentist is not required to stay in the dental office while the treatment is being done. For example, if the patient has come today and the dentist has diagnosed and authorized, say, prophylaxis, and then you've given an appointment and the patient is, say, coming after 2 days. So dentist is not there, but the dentist is the one who's gone ahead and given the treatment plan and the treatment required. So the patient can come back after 2 days, sit, get the procedure done, and go back. But the dentist would not be required to be in the office. However, the dentist will have to evaluate the performance of the dental auxiliary once it is done. Yeah, but for any patient to be treated by a hygienist, especially under general supervision, the patient has to be examined by the dentist. That is very, very important. They have to have their medical and dental history completed and evaluated by the dentist, and has to have their condition diagnosed and a treatment plan given by the dentist. All of this needs to be performed by the dentist. The dentist should give the dental hygienist prior written authorization to go ahead and perform this treatment, and the dentist should examine the patient following whatever services has been done by the hygienist. Okay, so this brings us to the end of concepts relating to dental auxiliaries and different types of levels of prevention. You have operating, non-operating auxiliaries, and 4 levels of supervision. So we'll just move ahead and discuss a few questions. You can go ahead and type your answers in the um, chat box. Okay, so the first question is the process by which a government agency grants permission to qualified people to engage in a given occupation is called, is it licensure or registration or inspection or an examination? Okay, so the government agency here is granting permission to qualified people to engage in a given occupation. That is your licensure. Okay. The next question is the list of qualified individuals who are listed on an official roster. Is that a licensure? Is that a registration, an inspection, or an examination? Now, the key here is there's an official roster, and it's a list of qualified individuals who are on a register, basically. It's nothing but a registration. Okay. Now, when you look at the following options, which of them are not included in the WHO classification of operating dental auxiliaries? So, when you look at operating dental auxiliaries, which of the following is not a dental hygienist, school dental nurse, therapist, or denturists? So, your dental hygienists, school dental nurses, and therapists all provide um, intraoral care. They are operating dental auxiliaries, whereas your denturists, they as such do not even belong to the WHO classification, but they are related or similar to your dental technicians. Now, a school dental nurse can perform all of the following duties except prophylaxis, pulp capping, root canal treatment, or topical fluoride application. Now, basically, your school dental nurse has the permission to go ahead and provide clinical care. The only thing they are not allowed and authorized to perform is your root canal treatment. Okay. Now, in which of these countries do you, as such, do not find dental auxiliaries? Is it in the US? Is it in India? Is it in Saudi Arabia or New Zealand? See, the United States, they do allow for quite a few dental auxiliaries to practice. In fact, the USA has the highest number of dental hygienists who are there. Similarly, in India, the Dentist Act basically gives permission for dental hygienists and dental technicians. They're allowed to be trained and work. In New Zealand, well, that is where your school dental nurse came from. So in Saudi Arabia, you as such actually do not have dental auxiliaries. Now, the dental hygienist comes under which kind of auxiliary? A non-operating, an operating, a dental specialist, or or a passive dental manpower. So, hygienist is involved in maintenance of oral hygiene. And how do you do that? By cleaning your teeth. What procedures followed? Usually oral prophylaxis. These are just ways to remember. So they're basically somebody who performs oral prophylaxis, and hence they are categorized or they come under operating auxiliaries. Now, we already have dental hygienists and the dental laboratory technician in India. Apart from that, which other type of dental auxiliary is actually most advisable for Indian conditions? You can have a school dental nurse or a health educator or an expanded function dental auxiliary. Actually, when you see this, for a country like India, given our population, our the situation, our schools and things like that, we actually could do with school dental nurses. So what happens is, you have your expanded function dental auxiliaries. They still in a way work with the dentist. The thing about school dental nurse is basically they're employed by schools, right? You have schools present almost everywhere in the country. So if we were to have a school dental nurse providing dental care in a country like India, it would actually be really beneficial. So whilst we still do not have school dental nurses, it is the most advisable type of auxiliary for a country like India. Okay, so when you see the term new cross auxiliaries, they are referring to dental nurses or dental auxiliaries in which country? New cross auxiliaries. Are they referring to dental auxiliaries in Malaysia, in Britain, in Denmark, or Singapore? So the key is in the term itself, new cross. New cross is an area in Britain. So that was where your dental therapist training actually began, which is why they're also called new cross auxiliaries. So they're basically nothing but dental therapists from Britain. How long is a dental therapist trained for? Usually 4 to 6 months is your dental aid. Apart from that, it could be your assistant or the dental secretary who basically learn on the job. But when you come to operating auxiliaries, especially, they are usually trained for a period of 2 years. Of course, that again depends on various other countries. Some countries offer training for one year, but what is usually followed is a 2 year training program for dental therapists, for dental hygienists, and for dental hygienists, sometimes in different countries have a training program longer than 2 years, and for your dental technicians. Okay, so this brings us to the end of today's session on dental auxiliaries. It's a pretty small and simple topic. Questions that can come are usually direct, and just remember the classification. Remember what is it that makes one particular type of auxiliary stand out from the other. What is it that makes school dental nurse different? What is it that makes a dental therapist different? Or what is it that makes a dental assistant different? So once you remember that, and then of course there are few names here and there, few countries here and there from where these ideas and concepts actually came from, and of course the years. So apart from that, you can remember the levels of supervision that there is, and I think that would help you completely cover this chapter. If there are any doubts or if you have any questions, please do mention it in the comment section. We will address it and get back to you. Thank you all for joining the session. Have a good evening.